This month is a powerful reminder of how important preventative care and early detection are, especially for those navigating healthcare coverage in retirement. That's why today we're covering the Medicare basics and highlighting how plans like those from Humana support screenings and services that help detect breast cancer early. Whether you're turning 65 soon or already enrolled or helping a loved one make sense of it all, we are here to simplify Medicare and show how it plays your role in overall well-being. Joining us with more is Matthew Miller with Humana. Thank you so much.
Hi, good morning.
This is some really important information. Medicare, I swear, every year it is changing. It can get really confusing. But why is right now an important time for those who are eligible for Medicare?
Yeah, it's a really important time for those that are eligible for Medicare. It's Medicare open enrollment. It runs from October 15th through December 7th. This is the time of the year where you really got to look and see what's out there and see what plan fits your needs. And preventative screenings, wellness exams, those are very important factors. You want to make sure you have the right plan with the right coverage.
Absolutely. And it's not like a one size fits all. You can't just go off of what your friends signed up for.
Yes.
You can't just like go on social media and see all of the chaos there. So what is the difference between original Medicare and Medicare Advantage?
Great question. And just to piggyback off what you said, right now I'm married. I have the same plan as my wife. I think all of us have been in the same boat up until we turn 65. And then it's different because unless you have retiree coverage, your spouse might be better off on this plan and you might be better off on a completely different plan.
Right.
But the main difference between original Medicare and Medicare Advantage, great question. So with original Medicare, the federal government is your primary health insurance provider. They're paying 80% of the bill. The good thing about that is that you can go to any doctor that takes Medicare. But the downside, or maybe the risk with that, is they're not paying that 20%. You have to pay that 20%. So if you have original Medicare, you go into the hospital, you could get a bill from the hospital themselves, the surgeon, the anesthesiologist, and that can really put a financial burden on some folks.
Right.
With Medicare Advantage, the federal government pays Humana to provide the coverage, or pays the Medicare Advantage companies to provide the coverage. We have to cover everything Medicare covers. So they regulate it, they make sure that we're covering at least at minimum of what Medicare covers. But with Medicare Advantage, it's in the private sector, so we have competition. So we're incentivized, we want to be the most competitive plan, we want your business. So with Medicare Advantage companies, you tend to get that private touch, whereas original Medicare, it's just standard government-funded insurance at 80%.
So there's just a lot to take advantage of and kind of really sort out your options. I mean, you can start doing this right now. Getting in touch with an advisor to kind of work through your options is really important too. But what should those eligible take into consideration when selecting that plan? Yeah,
I think you got to start with your providers, right? Making sure you have a plan that covers your doctors and the hospitals that you want to see. I would go to making sure your medications are covered and they're affordable because especially in the Part D or the Medicare Advantage side of the Medicare coverage, all the plans might cover your medication, but depending on what plan you're on, that cost could be higher or lower. Sometimes depending on what pharmacy you go to, whether you get it at a local pharmacy or through mail order, that can affect your copay and your out-of-pocket costs. So you got to do your research of doctors, medications, and then overall, like, who do you trust the most to do business with? Like, I always say you are your most important asset, right? And you got to make sure that you're taking care of yourself. So you should have a plan that you feel seen by. You should have a plan that covers your doctors and covers your medications. And you should have an agent that you trust to do your business with, or someone that you trust to help you make your healthcare decision. So it's a very important time of the year, yeah.
Absolutely. And you mentioned screenings a little bit earlier. In October is Breast Cancer Awareness Month. This is what the whole show this hour is about. And so how can Medicare really help those in need to be screened?
Well, I think what's great about Medicare is whether you get it from original Medicare or you get it from Medicare Advantage, we all see it the same. We cover preventative screenings at 100%. So that's important, no matter what you have, whether it be original Medicare, Medicare Supplement, Medicare Advantage plans. Those are covered 100%. And a lot of times, insurance companies will put out incentives or rewards for doing those services. So I think it's really important to catch something early before it's later.
Of course. And before we wrap up here, how can people get help, comparing those plans or just enrolling for the first time?
Yeah, so a lot of great resources out there. medicare.gov, you can go on there and look at all the plans from the Medicare website. You can do business with a local agent if you have someone locally that you know is a Medicare agent and they're knowledgeable. You can go online to medicareagent.humana.com. If you're looking for a local Humana agent in your area, we can provide that service to you, and you'll have a couple of different options to pick from and names and phone numbers to contact as well.
Good to know. And you always want to work with someone local, and seeing Humana locally run right here in Louisville, that is always so great to see. So thank you so much for stopping by today. I know Medicare can be so overwhelming and so confusing, but you're really trying to help everyone out there, so thank you.
Thanks for having us, Elle. Appreciate it. Thank you.
So again, if you're interested in learning more, just go to the website on your screen.